I hadn't been at Rutgers even a month when I was asked to send a letter of support for the NJ Heroes 2 proposal. It was one of the first letters I signed as president, and I was eager to do so. Already in that first month, July 2020, I was signing what would be a steady stream of condolences to the families of Rutgers employees and retirees who had passed away, affected in some way by the pandemic. Either that member of the Rutgers community had died of COVID him or herself, or they had died alone in a hospital because it was too dangerous to have visitors. It was all absolutely heartbreaking. That was a story happening all over the country, but as you know so well, it was happening disproportionately right here in New Jersey and to communities of color right in our backyard. I'm so grateful that this project got the approval and the funding to move forward because it wasn't just a good thing to do, it was the right thing to do. Looking at the summary of the project, several words jumped out at me. Words like trust, reciprocity, inclusive, open communication, and mutual respect. These can easily become buzzwords devoid of meaning, but they came to life in this partnership because of a conscious effort to build the plan with input, with real input from the community it was intended to serve and support. Taking that approach leads to discoveries that inevitably make a project work better and make a strong case for using that strategy as a model for every community engaged initiative going forward. My colleagues at Rutgers already know, I hope, how much I value their dedication to this project and to every part of our university's response to COVID-19. But I want to put the focus on you, our partners. On behalf of Rutgers, I want to thank every one of you, every organization, and every individual who contributed your ideas, insights, and wisdom to this partnership. Thank you so much. And thanks to everyone who is working directly or indirectly in providing healthcare during this extraordinary time, and who went the extra mile to fine-tune and calibrate this partnership. Congratulations.
It is a true honor to be able today to lend my words of deep appreciation and frankly awe in this celebration of a groundbreaking, collaborative, and enormously impactful partnership between teams of publicly engaged researchers, community-based organizations, and healthcare professionals, the amazing NJ Heroes 2 Collective, and your project leaders, Drs. Hudson, Hill, Blazer, Jimenez, Barrett, and Panettiere. You all deserve to be celebrated across this collective for the foresight you showed in October of 2020 to know that so many communities, predominantly Black and Latinx, across Essex, Middlesex, Passaic, and Union counties, and especially healthcare workers in home health, hospice, and community services, and their families in those communities, would be disparately impacted by the devastation wrought by the COVID-19 pandemic. What a phenomenal accomplishment, engaging more than 2,000 individuals in a rigorously designed and community-informed screening process that enabled at-home testing and the ready identification of local resources for positive cases, as well as solidifying an extended network for continued testing. So smart, so needed, and so successful. What an inspiring moment of cheer in an otherwise deeply taxing time when we are reminded every day of the long arm of systemic racism that finds its way persistently into the homes and neighborhoods and schools and workplaces of those who so deserve better, as they fight against the systems that have so withheld opportunity and so impacted health, safety, and economic viability, even as the communities most impacted continuously show forth their resilience and perseverance against all odds. What is so resoundingly important about this project, which is way more than a single project, and which will without a doubt continue to have its own long arm of impact, is that it gathered its own strength and insights and wisdom precisely from the very people most impacted, time and again, and too often ignored. Not now, not again, if collectives like New Jersey Heroes do have their way, and we know you will. As someone who has worked on anchor institution, university, community engagement for decades, I know from experience that a true university community collaborative, once started, never stops, especially when tackling the inequities, whether in health access, care, and treatment, or in other intersecting arenas of community need, be it education, policing, job training, wealth building, environmental justice, and the list goes on. From the start, you came together to merge the intelligence and insights of laboratory scientists and citizen scientists on the front lines, healthcare organizations and community-based organizations, mobilizing services to not only design the protocols, but to take seriously the messaging and the people whose lived experiences form the core of what it means to actually make progress. Your collective work from the start and going forward captures the key element of social impact. That is, it never happens alone. We are all in this together, all interdependent, and progress depends on the sharing of knowledge, the joining in common cause, and the humility to see that those who live with the issues of the day must be central to changing the landscape going forward. As one of Newark's legendary heroes, Rabbi Prince, said in his speech at the March on Washington in 1963, before his dear friend Martin Luther King Jr. spoke his prophetic words that pivotal day, and I quote Rabbi Prince, "Neighbor is not a geographic term, it is a moral concept. It means our collective responsibility for the preservation of man's dignity and integrity." May I congratulate again all of you who have come together across so many vital sectors, so many counties of New Jersey, and so many lived experiences to epitomize the true meaning of neighbors in New Jersey Heroes 2. Congratulations and onward in your common cause of justice.
Hello, I'm Al Richmond. I'm joining you from my home in Raleigh, North Carolina. I regret that I'm unable to be with you, but I wanted to take a moment to bring greetings to you and to say what an amazing job I know that you've done in Northern New Jersey. As a community leader with over 20 years of experience, I know firsthand the importance of community-based organizations, faith-based organizations, and others who join their efforts to address any issue. Back in 2020, it was my pleasure to have been contacted by my partners at the UNC Center for Health Equity and Research and the Duke Clinical Research Institute when they asked me to be a part of RADXUP. It was such an amazing moment for me as I thought about the opportunity to make a difference in the midst of a global pandemic. And I too joined this effort to mitigate the impact, the disproportionate impact of COVID-19 in Black and Brown communities. And so today I am saluting you as members of New Jersey Heroes 2 who have worked in your communities tirelessly and fearlessly to address COVID-19. I want to also recognize the New Jersey Alliance for Clinical and Translational Science and Rutgers University that serves as the linchpin of this work in Northern New Jersey. You're making a difference, and I want you to know that. We're in a moment when funders and others, even federal agencies, have recognized, number one, the disproportionality of COVID-19, and number two, the fact and the reality that it will take all of our collective efforts to address the deeply entrenched health inequities that are so pervasive in our communities. And maybe finally, the importance of authentic partnerships in addressing those issues. The work is too big, the work is too difficult to go it alone. And it's community leaders like you who make a difference every day. Thank you for showing up. Thank you for making a difference in your community. I hope to be with you soon and to see firsthand the difference that you are making, That operative word is the difference that you're making in your communities. And so, as I close today, I want you to do something for me. I want you to raise your right hand. Yes, raise it high. Yes, raise your hand, raise it up. And then what I want you to do is I want you to place it on your left shoulder. Or if you're left-handed, your opposite shoulder, right? I want you to put your hand on your shoulder and I want you to pat yourself on the back and say, job well done. You're making a difference. Thank you for making a difference.
Good afternoon, everyone. Yeah, there we go. There we go. It's an honor for me to be here this afternoon to read a letter from our governor. It's an honor for me to be here with you, all the heroes and the sheroes that are in this room on today. You put it on the line during this pandemic. Dear friends, it is my pleasure to welcome everyone in attendance for the commemoration of the extraordinary community engaged work accomplished by New Jersey Healthcare Essential Workers Outreach and Education Study, Testing Overlooked Occupations, NJ Heroes 2. During the most intense epidemic to touch our state, New Jersey Heroes 2 brought together researchers, healthcare providers, and community partners to combat the spread of COVID-19. The incredible efforts of NJ Heroes 2 is owed a great debt of gratitude, as it was the help of combined research, data collection, testing strategies, and education to residents from this important organization that has helped New Jersey mitigate the impact of COVID-19 on our residents and communities. On behalf of the state of New Jersey, I join with New Jersey Department of Health Commissioner Judith Persicelli and everyone who collaborated in this journey to applaud the NJ Heroes 2 members, committees, researchers, and partners for your extraordinary engagement and phenomenal hard work pre and post-pandemic to collectively participate and contribute to true partnerships that are effective in addressing issues that adversely impact New Jersey communities. It truly takes a village, and it is my honor to extend a congratulations to all of you involved. Best wishes for an enjoyable celebration and your continued success. My very best, Philip D. Murphy, Governor. Thank you very much.